it is usually the best time to go over this information early as well in the pregnancy, so the participant or patient has the information she needs to know when her baby arrives. So you can see here some of the things that can help serves as a benefit for breastfeeding. So it does help a little bit on increasing the level of oxytocin, which helps with the contractions of the uterus. It can also help with minimizing the blood loss that is lost during postpartum, and then can help, like many people say, returning to the pre-pregnancy weight. But that does depend on different factors. It might depend on um, also how the mom took care of herself during the pregnancy. Did she gain enough adequate weight gain during the pregnancy? Was she overweight or was she underweight as well? And then it might also depend on her current diet as well after postpartum. And then the other thing it can also help with to help prevent from chronic diseases such as diabetes, um, things like certain types of cancer or heart disease, other types of chronic diseases might that can happen if the mom didn't really take care of herself in a certain way during the pregnancy. So that's also why it's important to always have follow-ups with the mom during her pregnancy, and to prevent from having any of these issues as well. But what does help a little bit can be for breastfeeding can help prevent some of these diseases as well after postpartum. And the last one, which includes helping the mom to recover a lot faster um, of her recovery uh, after postpartum. So sometimes I do find some moms, this is based on my experience as working for WIC program. I do find sometimes moms asking after they have had like a C-section, if they are able to breastfeed. They ask me these questions, and then I usually let them know of course, you can definitely breastfeed your baby even after having a C-section. So I usually go over with them the type of positions of they can latch their baby on, which is mostly the clutch or football hold. So this is a very good um, latching position to for the babies to breastfeed. And this is also pretty good for moms or for women that also have large breasts. So there is a way for moms to breastfeed even after having a C-section, and then it can also help to recover a lot more quicker um, for these moms to recover. So, and there are many other benefits for breastfeeding for the mom that are not mentioned here, but this is just some brief information on the benefits for breastfeeding for the mom. Now we're going to be talking about the benefits of breastfeeding for the infant. So, same as the mom, there are also benefits for breastfeeding for infants. So, another thing also to mention, it is also important to discuss this information with the mom who is planning to breastfeed her baby or her next baby. So some of those benefits that also include for the infant is also um, provides all the nutrients that the infant needs. And I always like to let the mom know that every baby is born to breastfeed. So it is the natural it's a natural thing that happens. I can say almost automatically. It's a natural instinct that the baby um, learns or is born to breastfeed. Sometimes there are maybe situations where the baby may not be able to breastfeed. It can be including if the mom has ever been exposed to any drugs, or if there is like a special high risk condition that makes it difficult for the baby to breastfeed. But there are situations where we can help both mom and baby to be able to get to that breastfeeding, meet their breastfeeding goals. So it's always important to also talk to the doctor and nurses at the hospital if the baby, if the mom is planning to breastfeed. So this is also important to let mom know during early in the pregnancy, if their plans are to breastfeed, to let the doctor and the nurses know they are planning to breastfeed so they can have some time together when the baby's born to have that skin to skin contact so they can have that moment of bonding so that baby can also um, helps with the breastfeeding. So another thing that also helps with that is also provides the immunity for the infant. So the first thing that is produced is the colostrum, and then I usually like to mention about that that it does help to prevent from having allergies or also other illnesses that are gut related or other illnesses that can happen later on during childhood. So this is also important that it does help to prevent having immunity for the infant and also may help with lowering the infant mortality and which comes to the other topic about always also educating the mom about feeding the baby frequently. Um, Usually it is recommended to feed baby, wake up baby during the night, and then feed baby every like 2 to 3 hours. Whenever it comes to that, I always like to let the participant know that um, to be a little bit more better, it is recommended to at least feed a baby every 2 to 3 hours. 2 hours will be better, but but it is important to wake up the baby as well to not only breastfeed but also um, do other things like diaper changes and getting the baby to be comfortable, things like that. And then so we try to educate we do educate the mom on feeding frequency as well, so that the baby gets fed and also baby can gain the adequate amount of weight as well. So it can help to lower the infant mortality in terms of that the baby is getting um, enough to eat throughout the day, getting all those nutrients and minerals that are also found in breastfeeding, so that baby can be healthy. Which also another thing I also like to mention about that is not mentioned here on the slide. I also like to let the participant know that it's also important to have a support system at home to whether it's from family or friends or also from their partners or their spouse to also let them know, educate them on why it's also important to have this experience for breastfeeding and holding baby skin to skin, and then letting educating on what is normal about the behavior of the baby, and then what to look out for when they're crying or when they're sleeping or when they're hungry and when they're full. So it is very important to take mom um, or get the mom to get that breastfeeding help that she needs if she does need it, and also involve the partners and the family and friends that are also supporting this mom that is um, breastfeeding their baby. So it's also important to talk about this And it's very useful information to know, not just for the mom, but also for their loved ones to know about the benefits as well about breastfeeding and so forth. So these are just some information on benefits of breastfeeding. So the next slide we'll talk about next issues that is also found during breastfeeding. So these are some common issues about breastfeeding. You can see here low milk supply, which is very common. I do get a lot of participants who, when I ask them the question on if they're breastfeeding their baby, they usually always, most of the time, say that they are, but they're also formula feeding their baby because, you know, they did not produce enough milk, or they stopped breastfeeding because they did not produce enough milk. So this is very common. You might get a lot of people with this breastfeeding um, problem with having low milk supply, which is also important to help this mom if to get to where she needs to know where she needs to get. But before doing that, we want to ask the mom what does she know about breastfeeding. We want to meet where she's at that stage. Another thing, another common issue is sore nipples as well, engorgement. The mom might have plugged ducts or also mastitis, which usually involves sometimes fever. And if it does involve fever, then it's important to let the mom know to talk to their doctor about that. If they're experiencing any pain, discomfort, or mastitis along with fever, it's important to talk to the doctor about those issues and see what we can do to help this mom. And there are ways where we can help the mom to with solutions to these problems. And that's what we are going to be talking about next in the next slide. Now we're going to be talking about the practical solutions for these common breastfeeding problems. So the first one we have with low milk supply, the mastitis, also engorgement, plugged ducts, and also sore nipples. So some of the recommendations also or possible solutions that can help with, for example, with low milk supply, we can talk about why the importance of breastfeeding the baby at least 10 times or more in a 24-hour period. We also go over information on proper latching or also looking out for the different hunger, fullness cues, feeding baby every 2 to 3 hours, the importance of waking up baby for um, to start breastfeeding as well. We go over with participants may include, for example, the allowing the baby to also come off the breast on their own. Another thing that can help, for example, for plugged ducts, can be applying warm compresses or soaking the nipple in warm water before feeding. Also, what might help to start feeding on the breast with the that has the plug duct first, making sure the baby has a good latch or good position when breastfeeding. And also to continue to massage any lumps that might occur, or also the lump during the feeding as well. And another thing also for the moms to take a break when they need to get plenty of rest and before the next time when the feeding comes again. And what can also help with this is also drinking a lot of fluids, getting enough rest, avoiding having anything that might cause any discomfort, like having tight clothing or tight bra straps, or also anything that can be pressing on the actual breast that can cause that discomfort. What can also help with engorgement is also using some warm compresses for that, for at least up to like a minute or two, massaging, hand expressing, or also using a breast pump to help with the engorgement. And then, or using like a cold press compress between the feedings to reduce swelling for at least 15 to 20 minutes. And then other breastfeeding positions that can also help as well. Okay, so now we're going to be briefly talking about the article that is called The Determinants of Breastfeeding Initiation and Duration Among African American DC WIC recipients, Perspectives of Recent Mothers. So here is the title of the article and the authors of the research article. Okay, so a little bit about the background of the study. So this article was focusing mostly on a specific population, which was mostly on the African American population. So the research article was gathered information from African American WIC participants from Washington, D.C. And so various different clinics from Washington, D.C. That are participating in WIC. And then it did talk about the why these specific population was having low breastfeeding rates compared to other participants who were also on WIC, but those were different, a different population of a different ethnicity and race. So the background also included information of the importance of understanding the initial breastfeeding and duration of the breastfeeding for these specific WIC participants, and also the research study was understanding also the importance of the breastfeeding benefits, like we mentioned earlier, and also to help increase the efficacy among the breastfeeding women who were participating in this research article. Okay, so some of the methods that the research article was using, it was a qualitative study that used an approach and included the social demographic factors for African American DC WIC participants. And some of those social demographic factors included factors such as, was the pregnancy unplanned, or was it a teen pregnancy, or were there any infants that were had low birth weight from moms that had previously had a baby within the past year, or were there high smoking rates as well. So it used these methods to determine about why these participants had low breastfeeding rates during this study. And the next slide is going to be talking about as well on other methods as well. So there was actually 24 African American participants from 4 different WIC clinics in DC that were interviewed for this study. And what also was included were postpartum participants who were also invited to participate in the study. So coming back to that, when for the moms that also had their babies within the past year, were also interviewed during this study. First of all women were first screened to determine their eligibility to participate in this study. So 40 women were approached, but only 12 were found ineligible, and a total of 4 women were not interested at the time to complete this study for several reasons, but the interviews were also semi-structured about the breastfeeding intentions of the mom, um, what the expectations were, and also any breastfeeding obstacles that the mom may have encountered as well. Okay, so the results of the study. So a total of 24 participants of non-Hispanic African American women were chosen for this study, and their ages were ranged from 19 to 45 years of age. And all of the participants who participated had a caretaker, sorry, of a young infant. And then a total of 20 out of 24 of the participants had attempted breastfeeding. 13 total had also included formula and also breast milk. And also, 10 out of 24 total participants reported that they breastfed their infant from at least a month up to a year. And 19 total of these participants were breastfeeding by choice. So there were no other influences that affected their choice to build their ability to breastfeed. And also 17 total participants stated they were confident to breastfeed as well. Some did have perceptions of breastfeeding to be either positive or also negative from based on other people's experiences or that they have heard. But overall, the breastfeeding information was clear and was discussed regardless of the feeding method or choice by the mom, whether she decided to breastfeed or decided to formula feed. So, of this study, all participants did face challenges and obstacles with breastfeeding, but many participants did meet the breastfeeding recommendations or goals that were discussed with them during this study. Some participants were not able to meet these expectations, regardless of having support and the positive breastfeeding messages that they received and the help from others. And then the study did find that more support is needed to continue prevent the decrease of breastfeeding rates among women participating in WIC program specifically for this population, but also across the nation. There is more support that is needed to help these moms to overcome any disparities, any challenges and obstacles, um, so we can help the mom to meet their breastfeeding goals. Okay, so that concludes my presentation on practical issues and benefits of breastfeeding. So here are my references, and thank you everyone for watching.